time.
Frontline investigates.
What, if any, responsibility does the Fed have?
Tuesday night at 10 on MPT.
Parents are superheroes. You save the day for your kids when you play together, read bedtime stories, and give lots of hugs and kisses. You're doing a great job. Visit MarylandFamiliesEngage.org for more ways to connect with your kids.
LTYC Learn is an online arts learning system for educators, students, and families. Through virtual classrooms, Learn is a space to share ideas, access creative opportunities, and collaborate with arts practitioners. Visit ltyclearn.net.
Are you a Maryland renter at risk of being evicted due to COVID-19 related issues? Help is on the way with Maryland's Emergency Rental Assistance Program. You may be eligible for assistance in helping to pay current or past due rent and avoid the threat of eviction because of wage loss or illness due to the pandemic. To learn more, visit rentrelief.maryland.gov or call 877-546-5595.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. Coming up tonight, Congressman Jamie Raskin on turning a family tragedy into help for others. Also, how Maryland's 211 program makes getting help as simple as a phone call. First tonight, the latest report on the state's opioid crisis, and it again is not good news. We spoke with Robin Rickard, the new executive director of the state's anti-opioid program. Ms. Rickard, thank you for joining us. You are new to the executive director role. Congratulations on that. About 2 years with the agency, but you're not new at all to the problem of drugs in society.
I just recently, 2 years ago, retired from the Anne Arundel County State's Attorney's Office, where I prosecuted hundreds of cases from misdemeanors to murder. And then for approximately 10 years, I was on our felony drug unit there and also was involved with our drug courts in circuit court. And it was there where I just became passionate about saving lives, that it's not a choice, that these people who are coming into the criminal justice system, it's really, really hard to recover from opioid use disorder. So that's when I became passionate. And then when I retired, the former executive, Steve Shue, who I miss dearly. He is now Deputy Secretary of Medicaid and Healthcare Financing at the Health Department. He called me up and said, I know that you were passionate about saving lives in Anne Arundel County. How about helping me save lives in the whole state? So I became the Deputy Director and Chief of Staff. So I was that for approximately 2 years and then just became the Executive Director.
The role of the prosecutor in drug court is interesting because you're the prosecutor. You have charges to prosecute. On the other hand, you're trying to help people. How often did you succeed? How often were you seeing the same people back in drug court?
The recidivism rate here in Anne Arundel County was very good, and it is interesting being a prosecutor and in drug court because when you're a prosecutor, you're not allowed to talk to the defendant. You talk to the defense attorney. You're not even, so I wouldn't even look at the defendant. I would just deal with the defense attorney. So they were just a case number. Sadly, that's how it was to me. And you negotiate pleas and have your trials. But in drug court, there is a public defender there, but we're all a team. We're all like a family. And I'm telling you, we had, I think, about 100 people in drug court. They all became my adopted kids, where I really wanted them to succeed. If they didn't succeed, we would have termination hearings, but the judge would look at me. I would get teary-eyed because I knew because they failed in drug court, hopefully they would do well later after they served their jail sentence. But I knew that they might not succeed because our drug court was very intense with all the wraparound services. So, but I would be upset because I would think that I probably would never see this person again, and they would probably be a statistic. But on the other hand, if they did well, again, like I said, I never talked to any of the defendants. I would be giving high fives and hugs when someone was doing well. So it's very interesting, and pat on the backs on if they're doing well, just to encourage them.
Well, the statistics on the statewide level have been challenging. I mean, during the pandemic, the number of people, the number of lives lost to opioid-related overdoses has been going up, continued to go up in the last quarterly report. What do you think is driving that?
Well, it was pretty upsetting because the numbers obviously were going up from 2011 to 2015, and then they started to stabilize 2018, and then 2019, they actually went down 2.5%. So we were so excited because, I mean, there are so many people, so many passionate people out there working on the ground. My team was working overtime, and we saw those numbers go down, and we were excited knowing that our efforts were working. And then COVID hit, and the numbers went back up again. I wish I had a crystal ball because I really would have liked to have seen what would have happened, but for COVID. And we don't really know exactly what impact COVID had on the fatalities, but I mean, COVID impacted everybody.
You think about the stress that people were under, medical, health related stuff, employment, financial stress, and maybe the access to support mechanisms, whether it was AA meetings or something else, was interrupted.
Oh, absolutely. And, just getting to the doctor's office. I remember I saw something on Facebook that said, NA and AA meetings, what are we going to do? We can't go to these meetings. And we tried to get the word out. No, NA, AA meetings are essential. You can actually meet, just practice safe distancing and wear your mask, but absolutely you can. That is essential. We did a lot during COVID in addition to, trying to save lives of COVID patients. With the opioid crisis, lots of people were still working. There was a lot of telemedicine. That's one of the good things that came out of the COVID situation. Telemedicine, there was naloxone saturation through the mail. The Behavioral Health Administration did a spike alert system. We were frequently going to OD strategy meetings just to try to figure out what we can do in light of COVID. But the numbers did unfortunately go up.
And you think about all the businesses that had to shut down or were disrupted by the pandemic. The business of dealing drugs, supplying drugs, cocaine, heroin, fentanyl in particular, didn't seem to miss a beat.
No, and unfortunately, it's very upsetting because I heard on the street that when individuals, if they wanted to get drugs, when they would get their checks, their stimulus checks, they would go cash them, and the drug dealers were loving that. And it just made the hair on the back of my neck stand up. It's very,
so it wasn't just iPhones that took off. You also reported in this latest document an increase in prescription opioid deaths. Contrast that to what's been happening with fentanyl.
Well, fentanyl it's just been skyrocketing. Prescription drugs have been going down the past couple of years, and we're now investigating now that COVID numbers are going down. Now we can be more aggressive with the opioid crisis. So we're going to investigate that because that's it's upsetting that the prescription drugs or fatalities are going up when everyone is very much aware of what prescription drugs do.
What are the top initiatives of your office at this point?
Well, about 2 weeks ago, we launched Maryland SOS, which is Stop Overdose Strategy. And we are going to start to go out to all the communities. We're going to do regional town hall meetings. The Lieutenant Governor is going to kick us off with the first town hall meeting. We are going to educate the public and the community on the statistics in their area, in the region. We're going to invite the opioid intervention teams, the health department, the local treatment, state and local partners. Everyone is going to get together for these town hall meetings. We'll educate them on the statistics. We will educate them on the opioid restitution fund, which is the money that we are going to be getting from the opioid distributors, or the manufacturers. So right now,
those are like the pharmaceutical opioids.
Yes, sir. Yes.
Right.
So we're going to be getting, we already got 12 million, and we're going to be getting a substantial amount more in the coming years. So we're going to let the public know and everyone in the community know what you can use that money for. It can only be used for certain things, like there's a list, but it can't be used just for anything. It can be used for peer support specialists, mobile crisis, naloxone, different things. So we want to let them know what it can be used for, find out at the town hall meetings what's working in their communities and what's not, and find out what they would like us to use that money for in their communities once they know what we can use the money for.
The state's been working to make naloxone, brand name Narcan, which is essentially the rescue drug for somebody having an opioid overdose, make that more available somewhere on the boardwalk in Ocean City. How important is that to your strategy?
Oh, absolutely. Naloxone has saved so many people's lives. And we went out there, I think it was last week, with the governor, and the governor actually with the mayor stocked one of the naloxone boxes. And what Operation Save a Life is they are getting the word out to all the area businesses down there on the Eastern Shore, especially in Ocean City. And the area businesses are very open to training their employees and staff on how to use naloxone and keep it in the restaurants and the businesses. And there's going to be these boxes that anyone can access throughout the boardwalk.
Before we go, we should focus on a little bit of specific advice for people. First off, to not get hooked, how you can avoid fentanyl, opioids in particular. Even people who don't know they're taking that drug may find it mixed in with something. And the second part of the question is, if somebody's watching and either they have a problem, they know they have a problem, they have a family member or friend with a problem, where's the first place you go for help?
Well, I would say, for the answer to your first question, is just to educate yourself and educate your kids. I can't tell you, I mean, I've been a prosecutor for was a prosecutor for many, many years. And I keep trying to drill into my kids, please don't try anything, not one thing, because one time you could potentially get hooked. And all the health departments in all the different communities have so much information and literature on to educate everyone about addiction. For your second question, very easy. If anyone needs help and is interested in getting help, 211 press 1. That's all they have to do is call 211 press 1, or they can text 898 211. And in addition to that, go to your local health department, because there are so many passionate, loving people who, like, they are on the ground and that's all they want to do is save lives. Because fentanyl, like I said earlier, fentanyl is such a strong and dangerous drug, but we're Maryland strong. So I keep telling everybody, we're going to win this fight, but we need you to get the help that everybody's out there ready and willing and able to help you.
Robin Rickard, Executive Director of the Maryland Opioid Operational Command Center. Ms. Rickard, thank you very much.
Thank you.
A new state law honors the memory of Congressman Jamie Raskin's son by expanding the work of the state's crisis call centers. State Circle's Nancy Amata spoke with the congressman about supporting those with mental health needs.
We've replayed it tens of thousands of times in our heads about what we might have done, what we might have said. and so on. And, ultimately you're just left with this inscrutable thing of mental illness.
7 months after his beloved son Tommy took his own life, Congressman Jamie Raskin is sharing his pain and doing everything in his power to help others who are suffering.
He was depressed, and he was struggling with depression, which preceded COVID-19. But I would say that COVID-19 intensified his feelings of isolation and loneliness. We've seen huge increases in numbers of young people reporting mental and emotional health problems during COVID-19. And, we've seen these dramatic increases in alcohol and drug use, and of course the opioid epidemic, which is a nightmare.
Tommy Raskin's untimely death led the governor and lawmakers who once worked alongside Raskin in Annapolis to unveil a new program in his honor. Starting this month, trained professionals at the state's 211 Crisis Call Center can now periodically check in on a weekly or monthly basis with anyone who says they need mental health support.
The idea is that people can call when they're not necessarily in the thick of an emergency, but they're feeling depressed or down, or they've had suicidal thoughts, or, they're struggling, and they can say, here's where I live, and here's what I'm thinking about, and here's who my doctor is, and this is what I'm going through, but I'd like to be in touch.
Congressman Raskin and his family hope more people will speak about their pain.
There's no more shame in saying you have depression than in saying you've got diabetes. It's an illness, and we need to address it, and we're going to do it together. And our family does not want any other young person to leave the world in that way.
Congressman Raskin is now writing a book about Tommy's life and the causes he was passionate about.
It's just a terribly sad thing, because he gave so much to the world. He gave so much to his friends and his family. But at the end, well, like he wrote to us in his note, he said, please forgive me my illness one today. Look after each other, the animals, and the global poor for me. All my love, Tommy.
Look after each other, something Congressman Raskin intends to do by lifting the veil on depression and making an impact on Capitol Hill. I'm Nancy Yamada for State Circle.
Nancy, thank you. For more on the state's 211 system, we spoke recently with Timothy Jansen, CEO of Hyattsville-based Community Crisis Services, and Jean Dobbs at the Life Crisis Center in Salisbury.
The biggest thing we've seen is folks really struggling with how to just be normal, what's okay and what's safe, and some significant worries about not only their own mental health, but the mental health of their friends and family, as well as a great number of folks that are having some financial difficulty and wondering, I've lost hours because of COVID, or I've lost my job because of COVID, and how am I going to survive, and that sort of thing. So we've seen a lot of that. Our shelter is at record numbers and has been for over a year.
Jean, similar experience with the people that you serve?
I don't think anybody knows what normal is with something like this, and everyone's trying to find their way. And so I think their main concerns are money, how to pay for rent, how to pay for electricity, if I'm going to have my job when I get back from quarantine, how to get resources, how to get unemployment, how to get through to unemployment. I mean, it's just everything. COVID has affected everything. And even though they may not be evicted, or they can't be evicted, they can, still lose their water, because water is not covered under public utilities. And if they don't have water, they've broken their lease, so they can be evicted.
What do you do to help people? I mean, there are things here where you can help, and maybe some things where you can't do much.
We have a resource data bank at 211 that has thousands of resources, and it is heartbreaking when we can't find one resource out of that to help someone, but most of the time we can direct them to places like the Salvation Army, Habitat for Humanity. DSS has been a chore because their offices were closed. All state and federal offices were closed. And so trying to access help through those agencies has been a challenge for people. And, we just encourage them to continue to try. It's hard to tell people to wait, but in this climate of this pandemic, that it was a lot of waiting, and that is never normal.
We've been really fortunate here in Prince George's County. The Department of Social Services, even though they've been closed, they've worked from home, and they've been our conduit, and we can reach out, and we're taking lists of this customer needs this and that customer needs that, and can you help connect them so they get some much more personalized sorts of services. That didn't always work. Unfortunately, not everybody qualifies for everything. And so the other thing I think we do on the hotline and on 211 is that we help people think out of the box. When there's not a straightforward solution, sometimes talking about it helps a lot. Understanding it's normal, understanding lots of folks are going through it, and just really helping folks think outside the box as to what else might we think about. 211 specifically is probably about 17 or 18% of my call volume. And my organization takes 22,000 calls a month on a number of various lines. And Life Crisis in Salisbury, where Gene is, also has a variety of other lines where they take calls as well. I'm not sure off the top of my head what their percentage is, but 211 is generally phone-based around the state. We can recommend, refer, connect people with walk-in services if they need them, if they're open. The challenge is lots of them aren't open. And so sometimes, it's a phone call or a warm transfer. We do a lot of warm transferring, meaning somebody calls us and then we call the resource and we bring them on together so that the three of us are on the phone together, and then we pull back so that they've connected.
It sounds like, Tim, those calls to 211 can be anything, can be financial, can be mental health, can be mental health emergency.
Exactly. We have a whole range of 211 calls throughout the day and the evening, and it can be all of those things.
It can be anything from somebody having thoughts of suicide, somebody having a substance abuse emergency, a mental health emergency, folks needing basic resources, food, clothing, shelter, employment direction. Lots and lots of calls about unemployment because people were really frustrated that they couldn't get through. So lots of that. And the challenge with COVID is so many things changed so often, people couldn't keep up. And so we would have folks calling regularly to go, I'm not sure I'm doing the right thing. Or they'd want to report somebody. So-and-so's business is doing such and such. Are they allowed to do that? The concerned citizen that wanted to make sure folks were doing things right. So there were lots of those, but lots of unease about COVID. Where can I get tested? Where can I get a vaccine is the new, thing. So lots of things like that, but it can be anything.
I wonder if Tim and Jean, many of the people watching may not have an immediate problem, but maybe know somebody who is experiencing mental health difficulties at the moment and wants to get them some help. What would you advise in that third-party situation in terms of reaching out to you or reaching out to the individual that they're concerned about and offering some assistance?
Well, first of all, I want to know if the person is suicidal or having suicidal thoughts. And then I'd want them to ask if they have a plan. And if they have a plan, most assuredly, you're going to want to try and get them to the hospital or get a mobile crisis unit to them as soon as possible. But also, sometimes people just need to talk. And so if you're worried about your family member or your friend and they won't talk to you, then you can most assuredly have them call National Suicide Hotline or call 211 or ask us to call them, because we will call them to check in on them and to just talk through whatever it is that they need to get through. We also do follow-up calls with that to make sure that they're okay and that they have received the mental health services that they need, or that they're just feeling better. We tell them that a lot of times during this period of time with COVID, a lot of people are having a hard time getting into their mental health therapist, and we let them know that there are telehealth services that they can do that, like we're doing it right now. And so that they don't have to wait so long to get in. And so there are lots of different ways to approach your friend or your family member and let them know that there is help there, to let them know.
Yeah, I would totally agree. I would say making sure they're safe. From suicide or any kind of abuse or any kind of violence of any kind. But then, if they want to make the call to sort of see what might happen, we can certainly provide some education. If they want to, sort of figure out how do I have the conversation? How do I broach the subject? Folks really struggle bringing up mental health issues, especially suicide or substance abuse. And so, we can role play the conversation with them. We can help them, sort of figure out how to have the conversation. Oftentimes we'll say, hey, let's do a 3-way call. And we'll have them call the person and bring them on. And the 3 of us can talk. It can be scary to call a stranger and unload all of your sort of, very significant sorts of challenges to a stranger. And when you've got a friend on the line, it sometimes is easier.
Yeah, I'm guessing that both of you would rather hear from people sooner rather than later. If people are reluctant to make the call, as you've described, but from the moment they do it, they're changing the dynamic and maybe they're heading off a greater crisis down the road.
Well, what I always let people know, because most of the time they'll say, I've never done this before. I've never been in this situation. I don't know where to start. And I always tell them how strong and how brave they are to call, because that is the hardest thing to do, is to ask for help. And, I'll start trying to break it down, and can you tell me, I've just had it, I can't take it anymore. Can you tell me what it is? And then they'll say maybe everything. And I'll say, can you tell me one thing? And then we'll go from there.
Our thanks to Tim and Jean. Remember, Maryland's helpline is available 24/7 to provide support, guidance, and assistance. Please call 211 and select option 1 or visit 211md.org. Again, you can call 211 at any time. And that is State Circle for this week. We're back Monday with Direct Connection. Remember to follow us on Twitter and Facebook at MPT News. Now for all of us at MPT, thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
In the summer of 1958, England is in a Cold War.
What do you think of this rocket that's gone up?
And Russian-born inventor Samuel Petrukin is caught in the middle of it.
We work for the government.
The portrait of a family
It's idiotic to be taught how to sit
in a world